Hello all, welcome to Care Samvaad with me Mirchi Hemant. Today I have the special doctor, to call him Dr. Umesh Tukaram sir. Sir, so glad to have you.
Thank you for inviting to be on this show.
Sir, all of us have been hearing your name for a really long time. Finally we get to see you, sir.
Thank you very much.
Sir, the sad reality of the world right now is we've been hearing this word brain stroke a lot. Sir, firstly, please tell us what happens. What is that big story that happens behind a brain stroke?
To understand a brain stroke, it's an acute event. First of all, it's an acute event which happens very sudden. Catastrophic it is. And then brain works on two things. It's a nutrients and then as well as oxygen. And when they are cut off, brain for some time, it can withstand without these two and then stop functioning. And brain has a representation, like we have a thinking, we have execution, we have a understanding, we speak, we hear, we dress, we see things. All these are represented and then they function from our brain. So they have a different areas. So these different areas, they function particular that task. And these all areas, they are supplied by a vessel, a small thin vessel. And through that, the blood and as well as this oxygen, they go through and supply that, and then brain utilizes that and functions in its own way. When you just cut off that now, for some time, brain can withstand for about in a different areas for 1 minute or 1.5 minutes, and then after that, it stops functioning. The cessation of a function, stopping that function itself is a stroke. For example, I told you all different areas. These different areas have a different blood supply. When blood is cut off there, and there is a loss of a function. Loss of function can be in the form of a weakness, one half of the body, or one limb. There can be loss of a vision, loss of a speech, loss of a thinking, or loss of understanding things, or sometimes there can be a tingling numbness of a part of a body. So they can have a various manifestation. Unlike what we have a heart stroke or heart attack, brain attack is a little different. Because its manifestations are different, this way people fail to understand which is stroke, which is like a stroke. So we need to understand a stroke is an emergency event. There is a cutoff of a blood supply in a particular part of the brain and there is a loss of function.
So I'm sure stroke treatment is very, very important. But how do we know that these are the symptoms that are about the stroke?
One, all that functions which I just told you, it has to be a sudden.
Okay.
Bolt of a blue. Patient was normal about a minute before, and then next second, patient says, yeah, I'm unable to do this. So the event has to be very sudden. It very rarely, example, we have a different types of a stroke. Now let us come down to that now. Different types of a strokes are where there's a cutoff of a blood supply and then that results into loss of function. There can be a rupture of a blood vessel. That blood vessel is a thin, blood pipe which carries a blood. Sometimes there is a rupture there and then blood accumulates in the brain. That results in a stroke. There is another one. The clot within the vessel takes a much longer time to build up. That is called a thrombotic. So we have three. One is embolic, thrombotic and bleed. So they manifest in a little different way. Embolic in the sense there is a clot somewhere else in the body and then comes and gets stuck in the brain. That happens in a bolt of a blow. The other one, when there is a blood oozing there in the brain, that builds up in hours. Okay. There is another one, thrombotic, that means the blood clot happens in the blood vessel over a period of hours. So this has got a different time manifestation. Time scale is different. There can be sudden, it can be a sudden in hours, it can be sudden in days. So this is one. Second point is it can manifest or present to a doctor in a different way. There can be sudden loss of functions like vision, power, sensory abnormality. That means the sensation goes down. Sometimes they don't understand it quickly and suddenly they can become unconscious also. So these are all various manifestations. So as a layman at a home or in a working place, if he finds particular part of a body doesn't function, where he finds it very difficult to to carry out his task. Immediately he has to be alerted now, and then he has to be taken to a hospital, because most of the times, because earlier, about 20 years before, we did not have a technology where stroke can be treated in this form. Now the technology is improved, subspecialties have come up now, people are working in stroke, and they can enter into the brain through various ways and then get the clot out of a brain.
Doctor, the place that we are in, Care Hospitals, Banjara Hills, it's now an NABH accredited stroke center. Please tell me, doctor, NABH accreditation, why is it so important, or how is it extra special for the patients?
I think it's a good question. We have various, like especially if you take Hyderabad now, we have various hospitals. Many hospitals are there. Everybody puts a board like a stroke unit, stroke unit, stroke unit. What is the stroke? And then what is the stroke unit now? Stroke unit is not, everything is not only a doctor there. There are many people who are involved in it right now, starting from education of a patient. Okay, now here, what are people, what is the team involved in a stroke? And we have a board from a national level. This board is accredited by a national board, which is specialized in stroke. What they do, how are you tuned to treat patient of a stroke? Now, why this concept has come? Why it is not in a disease of a peripheral now? Why this board is not come in a board? So because the stroke is related to the time.
Right.
Stroke is related to the time, right. And you can reverse few things in hours by giving injections. That is called thrombolysis. If you miss that 3 hours of a window period, next is a day. In a day, you can enter into the brain through a catheter and then bring out a clot. That is called mechanical thrombectomy. So, in a nutshell, if you see it now, this is called a time. So, brain is related to the time now. So, in that case, what we do is we have to attend the patients in seconds and minutes.
Right.
So, now national board has, it has brought protocols.
Right.
In this protocol, what they said, it is not only the doctor who is important, there are other people also important, like the ambulance which is going to bring a patient to pick up a patient from a home. The ambulance, the driver has to be trained, the nurse who is there in the ambulance has to be trained, the doctor who is attending patient at the first site should be trained. What should be done for this? How they bring the patients now? How we need to coordinate with the traffic here? How do we get that patient in a window period? As soon as the patient comes to a hospital in the ER physician has to be trained. He should know the time scale.
Right.
He should identify stroke it is stroke or not, what type of a stroke it is. And then nurse in the ER, that is emergency room, she has to be trained. The patient has to, as soon as they just check all the vitals, patient has to be moved to a scan center. And then the doctor there in the scan area, he is called as a neurologist. He should be made aware about there is a patient coming up, there is a time scale here, patient is reaching the hospital, he should be tuned, patient should be ready, bed should be ready, take an MRI scan, within a stipulated time complete that task, and then bring him to ICU and then attend according to patient in what time he is. So this whole is called as a stroke team, and this has to be alerted in the hospital. Now how it should be alerted? It should be alerted by paging. There has to be a code for it.
Oh, wow.
So as soon as the patient comes, there are patients in the corridor, there are patients in the lift, there are patients in an MRI, there are patients in an ICU. Everything has to be given a green channel.
Wow.
So they has to be moved, triaged, brought to a table and then brought back to the ICU in minutes. And patient is attended in that window period and then solve the problem.
Doctor, this sounds like soldiers ready for the battlefield.
Obviously, it's like a coordinated work.
Right.
It's a coordinated work. If there is no coordination there, and then patient loses the time. I told you, time is a brain here now, and then we can't afford to lose the time.
Oh. Also, doctor, when you say strokes and brains and stuff, we keep hearing these words called ischemic stroke and hemorrhage stroke. Please tell us what is the difference, or how do you treat them differently?
See, it is something like this now. Every part of a brain is very important. Wherever there is an insult, it has to manifest in some form. And now we come down to type of a stroke. Type of a stroke is a there is a ischemic stroke, other one is a hemorrhagic stroke. If you see the ischemic stroke, it's the constituents of the blood itself. There is an abnormality. Constituents of the blood, that means, okay, they run in one typical fashion. So all these are clumped together and then form a clot, and this clot gets plugged within the vessel wall. If there is a bigger clot, if it cannot pass through, it has to go and get stuck or plugged in an artery which is smaller than the diameter of a clot. So it gets plugged in the vessel. As a result, there is a insufficient blood supplied to that particular part of the brain where it supplies.
Right.
And then that results into inadequate supply of blood to that particular area. So the demand by the brain and supply by this vessel, there is a mismatch.
Okay.
There is a mismatch. When there is a mismatch and that area of the brain doesn't function, that is called ischemic stroke. The other one is called as hemorrhagic stroke. Hemorrhagic stroke is the one where there is a blood running in the blood vessel, there is a rupture there, and then blood oozes out in an area which is not supposed to be there.
Oh.
So it goes and stays there in that particular area and occupies the space of a brain. As a result, there is going to be a compression of the brain. It's going to displace the brain structure, and when it displaces the brain structure, the wiring gets disrupted in a brain and results into a loss of function. So this is called hemorrhage. This is called as an infarct. Approach is entirely different. Here we give, because there is a clot there within the blood vessel, we give blood thinning medicines so that the clot gets dissolved.
Right.
Here we should not give blood thinning medicines because already there is a bleeding there. We try and support it. See, the dynamics are rearranged. And usually these people, they have a vomiting, they'll have a headache. These people will have a less headache, less vomiting. So this is how we identify. MRI, CT scan, they will all help us in identifying this. And we approach accordingly whatever we find on an imaging.
Doctor, stroke patients, okay? Please tell us what are the long-term issues that they'll have after they're treated from the strokes?
Now, I think till now we have understood loss of functions. Loss of function depends upon where this insult is. For example, if the insult is on the outer aspect of the brain and the insult is in the inner aspect of the brain, so we have two different areas. The outer aspect of the brain has got less of a tracts there. There are more of a cells which are called as a parent cells or parent body. And to have a maximum disability, we need to have a larger clot in the brain. For a larger clot, we will have a larger, a loss of functions, disability. If there is a minor, insult in the brain on outer aspect of a brain, we have a lesser disability. When it comes to a inner part of the brain, the smaller clots or smaller insult also will have a maximum disability. If you look at these two people now, the clot in the outer aspect of the area, they do little better. They do little better, and the clots which are there inside or inner aspect of the brain, they are left with a lot of a disability. Okay. So a lot of a disability. They take much longer time to improve. Some of them, they may not improve completely. And at the same time, the clot which come from a heart, they improve much faster. The clots which come from vessels, they are called as a white clots, they are called as a cholesterol clots. The clots which are formed within the cholesterol, they dissolve less. When they don't dissolve, usually the disability remains the same almost. So not everything is same.
Got it.
All strokes are not same.
Right.
They can have a varied presentation, they can have a varied improvement, they have various approaches. So it's a big ocean where I think everybody has to be alert. Patient has to be known about the facts there. Doctor should prognosticate patient, and we have a right approach and right center.
Right.
Right center.
I mean, from my understanding, a lot of people complain about, say, dizziness or imbalance and things like that. Is this a neurological problem, doctor?
Yes, dizziness is something related to unsteadiness, or some people say that dizziness is some kind of a a gray word where dizziness is used for many things. Sometimes they say spinning also giddiness, or sometimes they say blurring of vision is also a dizziness.
Does vertigo fall in the same category?
Vertigo is a general term where patient is unsteady, there is a spinning there, and he feels a little anxious about it, and they can be vomiting, and then he feels that the surroundings objects are revolving. So that is called as a vertigo or dizziness, or sometimes we say unsteadiness also. So dizziness as a part of a stroke, it does happen whenever there is a circulation disturbance in the back portion of the brain.
Right.
We have a front portion of the brain and then back portion of the brain. Whenever there is a disturbance or insufficient blood supply to a back portion of the brain, there we have a symptom called dizziness.
Okay.
Usually they have a dizziness, double vision, blurring of a vision, they are unsteady, they vomit, and they are, it's catastrophic event. Unlike, the front portion of the brain, it gives you much longer time, to get into the problems. So this doesn't give you. It warns only once.
Oh.
The warning doesn't come again and again. It just knocks you off.
Oh.
Here, in the front portion of the brain, this giddiness, the front portion of the brain and then back portion of the brain. Back portion of the brain has got a, predominant feature as a giddiness there. And it keeps warning only once. It doesn't keep warning again and again. The front portion of the brain, it can come as a warning. Warning we term in medicine as a TIA, that is transient ischemic attack. It comes and then goes off. That's a warning. What comes there? A different manifestation. It can come as weakness, vision loss, speech loss, understanding loss, sometimes tingling numbness, sometimes loss of functions. All those can come as a warning. Those are called as a TIA. That means you are having impending stroke, you are going to get a stroke in future or in few hours.
Right.
They can come multiple times in front portion of the brain, but back portion of the brain, no. It can come only once. Next time you should be ready. Prepare. Talk to your doctor. Get ready.
The body is telling you.
Yes. This is how. And stroke, I think I should add this word. I think it is going to be good for our viewers. Stroke is a planned act. Like Sherlock Holmes. It doesn't give you accident. Initially, about 30-40 years before, we used to label this stroke as a cerebrovascular accident. Cerebro means brain, vascular means blood vessel. So these two, there is an accident in the brain. It never is an accident. It's a planned event.
So it gives you hints, we just don't read it.
We don't read it. It gives you a hint that, man, this is the warning I'm giving you. Get ready, get investigated, and avoid.
It's like warning 1, yes. Warning 2, warning 3.
Yes, something like this now.
So we have to be alert.
Alert.
Doctor, also please tell me, in a lot of films that I've seen, मैं कहाँ हूँ, मैं कौन हूँ, memory loss.
I know. Those are called as amnesias. Amnesias are like a forgetfulness. That can be some kind of a. Usually amnesias, like what you said, okay, forgetfulness cannot be a stroke presentation.
Memory loss?
Memory loss is an event which occurs after many strokes.
Oh.
Not as an initial manifestation. It doesn't come as a memory loss. Patient will not come to you, say that I got a memory loss now, doctor, do I have a stroke? No. If you have had a stroke in the past many times, then you lose a memory. Memory is related to the functions of different areas of the brain. It is not one particular area. So what happens in multiple strokes? In a layman word, there are wiring in the brain. Today I sit and talk to you. There is a photograph of yours in me. It is already stored. When I see you next time, take out that photo, retrieve that photo, and then see your present photo and compare in my vision there in the memory. Oh, this is
the same guy.
Yeah, same guy. I should wish him now. So this process, which happens in the brain, happens in a fraction of a second through a wiring.
Okay.
It happens in a wiring. So this wiring connects the different areas of the brain to have that smooth thoughts, and these thoughts are converted into a speech and functions, and we execute it now.
Oh, got it.
And think that, okay, now I see you, but I'm not able to retrieve that previous photograph. And then there is a dewiring there. I had a stroke between that connections now. And then when I see you next time, and then I'm not able to retrieve that photograph and then tell you, I have seen you somewhere.
I've seen you.
Yeah, I've seen you somewhere. Then you say that, we were there. Then there is mild wiring because I go through some other area. Some other wiring I go through and then retrieve the data. Yeah. I think, I have seen. Yeah, you are right.
So when I keep reminding you, the connections happen slowly.
Connection not happens, I go through a different way
Okay.
to retrieve that data.
Right.
So this is the wiring and dewiring. When dewiring becomes more and more, I lose a memory.
Oh, got it.
So that means, to lose a memory, person have to have a multiple strokes in the past.
Does this extend to Alzheimer's also, sir?
Alzheimer's is different. Alzheimer's is, the dewiring happens because the parent cell is functioning less or not functioning.
Okay.
So as a result, there is a degeneration. Degeneration in the sense, for unknown reasons, the cells start functioning less. So there is a dewiring happening and the patient is unable to retrieve the data.
Doctor, like you said, I have so many questions, I'll keep on going. But one important point that I want to ask was the word epilepsy that keeps popping up every time you talk about stroke. Please walk us through that. What is this?
Epilepsy is something like this now. We know that brain, there are cells there, they are connected to a down to execute the functions there. They are called as the tracts. So these cells there on the outer surface of the brain, they are always alert. So when there is a function there, that means there is a transmission which is occurring across, like what we see in a wire here. So there is electricity passing through that, and this electricity passes through a particular wire, and then there is a neutral wire, there is a positive and then negative there. The same way we have in the brain also. When it passes through that, and there is a short circuit, that means all of a sudden in some particular now there is excitation there. There is a short circuit in a layman word. When there is a short circuit there is a burst of activity there. There is a burst of activity and there is a spark. So when there is a spark there, whatever function they were doing before, that all stops.
Okay.
So as a result, there is no conduction across the nerve and there is a burst of a neuron, and as a result there is some kind of a sparkle which is happening in the brain, and patient throws a fit. He throws a fit depending upon where the focus is. If the focus is something in the in a motor area in the sense where there is a weakness there area, then we throw a jerky movements of a body. That's called a seizure there now. Or if it comes into some other area where there is vision area, if you have a spark there, then we get some kind of a visual disturbances in them. That is called as a seizure or as convulsions. Now these seizure and convulsions, if they are grouped together, if he has got more than two, multiple are there in the past, they are called as an epilepsy. So it is a disturbances in the neurons itself. There is a electrical disturbance in the neuron resulting into a sparkle there, electricity burst there, resulting into an epilepsy.
Doctor, finally, please tell me, people talk about mental health, emotional health, physical health. Yes. What should one do to have brain health? Is there something called brain health?
Yes.
What should one do?
In fact, it is something like this now. Brain is constantly functioning. It controls other organs also. There is a chemical disturbance in the brain, and there is a chemical transmission occurring in the brain, and electrical transmission also occurring in the brain. Just look at it now. If you have a machine which is in a routine practice, which you are using it daily, if you use it on electricity continuously over a period of years, decades, what happens to that machine? It has to get tired.
Yes.
It has to get tired. And brain is also the same. People don't understand it. They use it, abuse it to a certain extent where it wants to take rest. That's how they say, if you have a very sound sleep of 8 hours in the night, it again reignites in the day.
Oh.
So in the night when it sleeps, whatever waste materials are there in the brain, they're all flushes out.
Right.
They all flushes out, and the next day morning you see brain is alert, attentive, and then it's into full efficiency.
No more Instagram in the night. We should sleep.
Yes, we should. No Instagram, no videos, no, even if you want to use something like, okay, which is very, very, very important. Very, very important, it will not come every day. In that case, you have to use a blue screen. In the, you have to adjust yourself, change it to a blue screen, and then, there the intensity of, brain function will be less than that. Yeah. So we have to have a very good sleep for the brain to recover in the morning, and then to flush out all that materials from the brain. Otherwise, if the materials are not flushed out of the brain, then it is a tired brain, you are going to lose a memory, and then, slowly you are coming down in your functions.
That's it, doctor. Every corner I find, I'll sleep now. I decided.
Yes, and we keep in mind about our daily functions also.
Like I said, doctor, this is like endless. I can keep on going. However,
neurology is very interesting to talk about neurology. It's like watching, the old stories, which are very interesting.
True.
Unlike other organs, it is so meticulous, very well planned, and then everything is like a mathematics.
You need brains to understand brain.
Brain, yes. Yes.
Doctor, I have a quick round. It's called the rapid care round. Okay. Now you got to be giving us answers in a line or a word. All right. First one. Most common myth about epilepsy?
I think, probably it is a curable disease. I think we should take out. And then it is not a stigma at all. It's a 100% curable disease. Very few disorders are there which are not curable.
Is memory loss always a sign of dementia?
Yes.
One lifestyle habit that boosts brain health? Sleep.
Yes.
Can screen time cause a real cognitive decline?
It is not proven, but yes.
But yes.
Yes. It is not proven. Yes. Now we see that there is a correlation between that and then it's dementia we see.
Everyone like me are feeling guilty now.
No, we see everything in life should be appropriate. Yeah. Whatever you exercise also, you cannot be erratic.
True. One food that's good for brain function?
I say
biryani.
Watermelon is really good.
Not biryani.
Biryani, I think if you eat appropriate amount, it's good for taste. But it's not going to be good
Sir,
in any way.
you say appropriate and you say so much. Got it, doctor. Can migraines lead to neurological disorders?
Not serious neurological disorder. Yes, sometimes it can cause a transient. That means temporary deficits.
Right. Is vertigo more common in women or men?
Yes, because of hormones, because of thyroid disorders. Yes, it is little common in women.
What's worse for the brain, sugar or stress?
Both are bad.
Can strokes be prevented entirely?
Yes, 99% of the strokes can be preventable. There are few strokes, they are genetically related. Those disorders are controllable.
One final question. One time or every time, when is that time where you feel, wow, my brain worked brilliantly?
When I diagnose.
Wow. Honestly speaking, even now, sir, thank you so much.
Thank you very much. Thank you very much. It was a pleasure talking to you.
To you also, sir. Thank you so much.